Hey guys, so in this video I wanted to talk about one of the biggest tips that I think really helped me when I was first starting out in my current job as a medical assistant at the rural health clinic that I currently work for. Um, and that is learning how to anticipate the needs of the provider that you are working with. Um, so I normally work for the same provider. However, I can be pulled to work with any provider that is in need of nursing support. So what that means is I do work with a provider on a very consistent basis. He is a physician assistant, and most of the time I work with him, like unless another provider is in need of nurse coverage, they will pull me to cover that other provider. So for example, there are some days that instead of working with the main provider that I normally do, I will cover urgent care, or I will cover one of our internal medicine docs. Um, or if my provider is out of the clinic, I may float to cover whoever needs additional support. We do have a couple of CNAs that work for us on a normal, consistent basis, and they need nursing support. So when the CNAs work in our position, we have to basically help them with injections and vaccinations and things like that, because at the hospital that I work at, our CNAs are not allowed to do any of those things. They are simply told that they need to come find one of the nurses. And when they say find one of the nurses, MAs are considered clinic nurses at the hospital that I work at. It's not our professional title, obviously, because we are medical assistants, but you get what I mean. So I've gotten down pretty well what my provider expects. For example, if somebody comes in with a sore throat, I am normally doing a throat swab along with a culture swab, just in case the rapid strep is negative. Then we will usually culture that. Unless it's positive, we normally don't culture. But when somebody comes in with a sore throat, I will automatically run a rapid strep, just because strep has been going around in our clinic lately, and we've seen quite a bit of it. So right off the bat, if somebody says I have a sore throat, I will run a rapid strep, and I will do the culture swab at the same time, so then I don't have to go back in there and re-swab the person, especially if it's a child. Children can be especially difficult to try to swab them. It's uncomfortable, obviously. Sometimes I do end up having to go back in and swab them again. For example, if the provider wants to order a COVID test, or if they want to order a respiratory viral panel or something like that. But I will normally get the rapid strep out of the way. If somebody comes in with UTI symptoms, I am anticipating that there will be a urine dip, as well as potentially a urine culture. So I will have all of that stuff going by the time the provider gets in to see the patient. So obviously not the culture, because the culture gets sent to the lab, but I will have had the patient use the restroom and provide me with a urine specimen so that I can at least do the dip, so that I can do that wave testing and at least give the provider an idea of what may be going on. I will also try to anticipate, like if I know somebody's coming in for a procedure, I will try to have all of those things collected and either at my desk or in the room already. I don't always like to leave things in the room like that for specific patients, just because I'm a little like uneasy about leaving like needles and things like that in the room with patients. We do treat a lot of patients with addiction problems and things like that. So I'm a little wary of leaving needles and things like that around, not secured and where I don't know exactly what is in them. So those things stay at my desk. But if it's something like somebody comes in to have stitches or staples removed, I will normally put one of those suture removal kits or staple removal kits in the room, just so that I already have everything kind of set up for the provider, so that by the time I'm done rooming them, they are able to just go in and get that whole visit out of the way. Staple removal and suture removal or stitch removal, those tend to be super quick appointments. Another appointment that's super quick for the provider that I work for anyway, or work with. I don't work for the provider, I work with the provider. Another one is like joint injections. He doesn't do every joint injection, but he does a lot of knee injections. He does a lot of shoulder injections. We have done trigger point injections. He does not do anything with the feet. I know a lot of patients come in and like ask us for foot injection or like a spinal injection. We actually make them go to a specialist to get those things done, like either pain management or neuro, just because we don't want to mess with that and screw up something. But we do a lot of knee. We've done a few hip injections. We don't do those as often as knees, though. I feel like our main injections are knee and shoulder. But like I said, we do a few hip injections as well. If you guys are curious about like the whole process that I go through to get everything ready for a specific procedure, let me know and I can make a video like addressing step by step what I go through and the process for getting everything ready to do a specific procedure. Obviously, I do a lot of procedures on a day-to-day basis, whether that is something as simple as getting everything ready for the provider to go in and do like freeze warts or do a certain type of exam, whether that is like a sports physical, DOT, because my provider does also do a lot of DOT and OC health things. So right off the bat, when I know somebody's coming in for a DOT physical, I will also have them do a urine, just a dip. There's a specific way that we order it in Epic where it says like Michigan Department of Transportation, UA dip, and then in parentheses it says WT, which stands for wave test. And that is because when somebody is trying to get their CDL or renew their CDL, they do have to do a urine sample. We do not test them for drugs. We test to see if they have any glucose, any protein, anything that's off about their urine that could affect their ability to drive on a daily basis. Obviously, that would be something important to know if you are providing someone with a CDL. So, those types of things, it's just kind of getting used to it. And I think the more that you work, especially if you work consistently with the same provider, the longer you work with them, the more you will come to know what they expect, how they want things to go, what things need to happen with a specific type of visit, etc., etc. So anyways, I hope this was helpful. Like I said, if you guys want any more specific information about specific procedures or just have any questions, feel free to leave them in the comments below. I would love to make a video sharing my thoughts and tips and tricks, as you guys very well know. And I will see you guys in my next video.